Straighten your leg out. Okay. Deep breath in and press. 1, 2, 3, 4, 5, 6, 7. Release.
Good morning. Today we're here with Walter. Good morning. Walter, I talked to you on the phone to schedule you. Why did you call me?
Because I wanted to get back in shape.
Back in shape? Were you in pain?
Yes,
Where?
with my right leg.
On your right knee you were hurting. Okay, so we're gonna start you right now with Dr. Davis, and we're gonna see how you're doing after. But first, we want to see where exactly it hurts. So I want you to stand up. Did you feel any pain when you did that?
Yeah,
Point to exactly where it hurts.
right there.
The whole front or just in the middle?
Yeah, the front and the back.
And the back. Okay,
Back most of it than the front.
I see. So now we're going to do a squat. I want to see if you feel pain when you squat. So put your hands forward. Very good. And then come back up.
Yeah.
Where was it? Exactly the same
Yeah,
places?
same.
Okay. And now I want you to do the stairs. Tell me how that feels when you go down the stairs.
Yeah, I'm like weak with pain. I don't have the strength.
You don't have the strength.
Yeah, that's what it is.
And when you went down, is it in the same spots or is it different?
Yeah, it's the same spot right there. More
Mostly
there.
in the back when you
Yeah.
go down. Now go up and let's see where the pain is when you go up.
Yes, actually less pain.
Less pain when you go up, more
Yeah.
pain when you go down. What would you say your pain level is today when you did the squat?
Maybe 6.
About a 6? Okay, and then how is this affecting your life?
Oh,
Do you do things? Do you do like gardening or
dancing.
dancing?
And running.
Did you tell me you
So-
stopped dancing because of the pain?
Yes, I stopped.
Oh, so now we want to go back to dancing. And you like to run and you like to garden and that bothers you too. You
Yes.
want to keep your yard nice.
Yes.
All right, let's get started and see where we're
Starting to pull in the back of your leg.
He's done martial arts, so he should have some decent flexibility.
Is it getting tight in the back of your leg?
That's okay, so
Okay,
Keep
deep
the
breath
knee
in.
locked though. Keep that knee locked.
Keep your knees straight and press. 1, 2, 3, 4, 5, 6, 7. Release. Okay.
Deep breath. And up. Go. 1, 2. There you go. 3, 4, 5. Keep going. 6, 7. Reach to the floor. Down. Good. Deep breath. Doing okay?
different, okay?
Take it easy. Watch your stride is going to be longer, Walter, because we lengthen your psoas muscle.
So bigger steps.
How does that feel?
Okay. Deep breath.
Did you notice any difference?
Huh?
You notice any difference?
Yes, I'm more flexible, I would say.
Yeah?
It's
Okay. What did you tell me to do? Nothing?
What's your pain level?
Oh, yeah. Oh, wow. That's
Like,
right. That's right.
no pain.
No pain.
no.
Oh my goodness. Well, we're going to do the exercises outside and see how you're doing on those. We're back with Walter, and Walter just finished his very first treatment with Dr. Davis. And how you feeling right now?
Much better.
Awesome. So we're going to do your exercises and see where your pain levels are.
Okay.
Please stand up. Did you feel any pain when you stood up?
Yeah, very little.
Very little. And let's do that squat. Let's see how that feels. Do the squat. Put your
Oh, the
hands,
quick
yeah.
squat.
Put your hands in front. Squat down. Now, how's that feel?
Much better.
Okay. And you were at a pain level of 6 last time you did that squat. Where are you now?
I was at before I was at the pain level 6.
Yes, that's what you
Now
told me.
it's, I would say 3.
3 now. Okay, so we're going to come down the stairs. That one bothered you too, right?
Yes.
And then how do you feel going down the stairs?
Well, much better than before the treatment.
Okay, okay. And then would you say right now that pain level for going down the stairs?
2.
2. All right, let's go up the stairs. And how did it feel going up the stairs?
Well, less pain.
Less-
That's all what I can
Yeah,
say.
because that one wasn't so bad, right?
No.
Okay. So, and that's not even with the other therapies. So
No.
that's pretty good. All right, let's keep going.